Hi, my name is Jerry Murray. I'm a registered dietitian at Good Samaritan University Hospital. I work on the cardiac telemetry units and the cardiothoracic surgery units. We're going to talk a little bit about diet and cardiovascular disease today. Um, I think one of the first things that comes into most people's minds when they hear about cardiovascular disease is cholesterol. And though cholesterol levels are important, it's not the full picture. Um, Cholesterol is only part of it. What we really have to think of is also what's called the endothelium, and that is the lining of our blood vessels. And with the endothelium, if it gets injured, we set the stage for plaque development, which of course we don't want to do. And how can it get injured? It can get injured by inflammation. Now, inflammation is a normal reaction from the immune system. So, for example, what's called acute inflammation would be if you cut your finger and the finger has to heal and the white blood cells engulf the bacteria. That's a normal reaction. It's short term, and that's the end of it. With chronic inflammation, which can be caused by things like stress, not enough sleep, poor diet, poorly controlled diabetes. When that happens, and that goes on for a long time, usually like months or years, that's where it can cause damage. And again, like I said, when the endothelium is injured, it sets the stage for plaque formation. Okay, so how can we decrease inflammation? Number one is if you're a smoker, stop smoking. Okay, for many reasons. Also, decrease your stress level, or at least how you learn to control how you react to stress. There are other ways of doing it. You can do different types of exercises, yoga, tai chi, also to help with that. You want to make sure you're getting enough sleep. 7 to 9 hours is what's recommended. If you do have sleep apnea, certainly speak to your doctor about possibly going for a sleep study. Weight loss, of course, is important, especially abdominal weight. In the abdominal area, that seems to be the most problematic with inflammation. You want to control your blood glucose. If you're diabetic, keep your A1C below 7. Manage your lipid levels, your LDL, your triglyceride levels. Plaque is primarily made up of LDL particles, so definitely, heed your dietary instructions in order to keep the LDL down. You want to control hypertension or high blood pressure because the increased pressure in the cells in the blood vessels can be damaging to the endothelium. Okay, so if we focus on diet, just remember one thing: everyone always thinks about what they can eat, and that is part of it. But you also got to think of the foods that you do eat, and you want to maximize or increase the healthy foods that you do eat. So, of course, you want to decrease sodium in the diet, you want to decrease saturated and trans fat, and you want to decrease refined, processed type junk foods, foods that are high in added sugar. Okay. There's actually a USDA recommendation for added sugar. It's no more than 10 teaspoons a day, which is roughly 40 grams. You want to increase your unsaturated or healthy fats, and that will help keep your LDL in check, and as well as your triglyceride levels. You want to include antioxidants in your diet. You definitely want to make sure you're getting enough of that. Fruits and vegetables are full of antioxidants. Try to vary the different types and colors of fruits and vegetables that you eat, because the different colors are made up of polyphenols and flavonoids, and those have a very strong antioxidant effect. Whole grains are great because of the fiber content. They can help keep your blood glucose levels in check, as well as your cholesterol levels. And legumes like beans, peas, lentils, they contain arginine. Arginine can help with the blood flow, help keep the blood flowing through the arteries, because it kind of acts as a it makes the arteries expand. All right, so let's take a closer look into the diet and try to put it into practice. Sodium, of course, our biggest contributor is processed foods. So things like canned vegetables, canned soups, cold cuts, those type of things. Definitely want to minimize that. In order to actually replace salt, you can use herbs, you can use flavored vinegars, you can use lemon juice. There's Mrs. Dash. There's other ways to get around it. You could also make your own spice blends. Now, as far as saturated fat goes, definitely red meat would be a contributor. You want to limit your red meat to once a week, all right? And try to choose a loin cut. Loin tends to be a leaner cut, all right? And keep the portion at 3 to 4 ounces cooked. You also can substitute ground poultry, either chicken or turkey. It can be used in meatballs, meatloaf, chili. It makes a pretty good substitute. Okay, dairy products can also have a lot of saturated fat, so you want to definitely choose, whether it's yogurt or milk or cheese, choose a reduced fat or low fat variety. Okay, try to do a meatless meal at least once a week. Grain bowls are one good example of that. It's a combination of a grain and vegetables and sometimes beans with like a light dressing on it, and it's a great way to get in your vegetables and your grains. Okay, and then healthy fats, you choose, like if you like avocado, that's a great source of monounsaturated fats. It can be used, you can have it on toast, you can put a slice or two in a sandwich, make your own guacamole. Nuts and seeds are also a good source of healthy fat. They can be, added to cereals, added to yogurt. You can put them in salads, especially if you toast them first. It enhances their flavor. Definitely try to use extra virgin olive oil, and you can also use avocado oil as well too if you like that. As far as omega-3s, it's most prominent in the cold water fish, so salmon, mackerel, sardines, albacore tuna, all good sources of the omega-3 fatty acids. Okay, fruits are a good source of antioxidants as well, like we said, and because we're going to cut back on sugar, some people need something to satisfy their craving for sweets, so you can definitely use fruit as a snack. You can add to cereals, you can make your own smoothies, and vegetables as well. Again, snacks, you can have it with hummus, which is very healthy dip. And you could also have roasted vegetables instead of just having steamed all the time. So basically just toss the vegetables in olive oil and put on a cookie sheet and bake it in the oven. And it really enhances the flavor because it tends to caramelize the natural sugars that are in the vegetables. You can combine vegetables with pasta, kind of cutting down on your portion of pasta, stretching it a little so you can cut down on the carb and calorie content of it, but yet still get your vegetables in. Okay, and whole grains, things like barley, farro, quinoa, those are all really good whole grains. Quinoa is very high in protein. They're very easy to prepare, basically, a 1-to-2 ratio of grain to liquid, and just simmering covered for like 20 to 30 minutes. Okay, you could have it hot. You could also use it at room temperature or cold as a side dish, adding chopped vegetables to it and a light dressing. Okay, so those are just some really good ideas there. I hope I've inspired you today to make some positive changes in your diet, but I do encourage you to visit your library, browse, cookbooks. There's many out there. Some good cookbooks to look at would be anything to do with either the Mediterranean diet, the DASH diet, the Mayo Clinic diet, or the American Heart Association diet. They all have cookbooks, and they'll give you even more ideas. Even if you don't follow the recipe exactly, it's going to kind of give you more ideas of what you could do on your own. Okay. And if you want more information, please visit www.goodsamaritanuniversity.org. Thank you very much.